So, with all this said, let us please dive into our first presentation and panel of the day. So, over the next hour and a half or so, we're going to examine the future of lung cancer in Europe, looking at power dynamics, innovation, issues around fair access, and the patient's voice. As you all know, I'm preaching to the choir for sure, these conversations are ever more important, especially as global power dynamics shift what seems like daily, and they have repercussions on everything from where clinical trials are done, all the way down to how a country balances its health budget and decides to allocate funds for a new therapy, or not. Now, to help kickstart this conversation, please join me in welcoming to the stage our keynote speaker, Penilla Gunther. She is a member of the Cancer Mission Board, which is a formal expert group set up by the European Commission. Penilla, the floor is yours.
Well, thank you so much, and good morning. It's a good morning, isn't it? We're here, we're alive. Just start with that. I think I need to start by being a bit personal, even though I'm here because of my position for the European Commission. But I think it's all the time when I meet some kind of patient organizations, networks, and so on, I think it's so valuable to tell you all that you are amazing. Because without you, I don't think that, policy work, what I'm doing, could actually be that good sometimes without you. And you can also work with policy from your perspective to create even more and better policies. So let's start with that. Have that in mind when I'm boring you now with some European Commission things. Actually, I would like to start with building on what Hugo and Elisabetta was talking about yesterday. But the title for my 15 minutes is actually Why Care at the National Level? I guess that someone here in the room yesterday was thinking, okay, that's very interesting with the European Commission and everything in Europe, but what does it do for me, or what is my role in all this? Well, beside that, we all are citizens in the European Union. Well, I think most of us, at least. We do have a role to play, and I hope that after my 15 minutes you will have an idea about that. So, just to remind you and maybe inform a bit about how this goes together. We all know about the European Cancer Plan, but we also have this Cancer Mission. And the Cancer Mission, I would say, is providing the research and innovation engine by providing also funding for that through the Horizon program. And maybe some of you have been involved in Horizon together with other stakeholders. But I think it has been more than 7 years now that has been going on. And my role in this is to provide some kind of advisory. The Cancer Mission Board is an advisory or expert group. We are selected from different angles, and my angle is to, I think it has become at least my own choice as well. I have a policy background. I've been a member of parliament. I've been a member of the Nordic Council and a lot of positions. So I know policy quite well, how to create legislation and so on. But I also have a patient background. I've had cancer twice, and I think it also brings, hopefully, a perspective also from the patient side and how patients can look at different initiatives taken by The Commission and this group, within both the Europe-Beating Cancer Plan and the work from that, and also within the project funding, we can initiate projects within the Horizon program. For example, we have a very well-known oncology pediatric expert in the group, and he said right away we need to create some kind of funding for research also for children and adolescents and young people. We also need to, and another one said, we need to create more research for elderly people living with cancer. And of course, we have all this in between as well. But we can initiate, and we can also be part of some kind of evaluation. We don't want to have funding for similar projects all the time. We need to have innovation. We need to have innovative projects also that can bring some other angles to the cancer area. And of course, we have these shared initiatives. We have the UNCAN, it's for research, understanding cancer. And we all have this ECPDC. I'm in the steering committee for that. European Cancer Patient Digital Center. You know, all these abbreviations, it's crazy. And of course, the cancer comprehensive centers that are starting, getting certified all over Europe, and so much more. But we are working together within the goals of the Europe-Beating Cancer Plan. I think when we talk about both the plan and the cancer mission, we need to see that what the key objectives are. I mean, we need still to improve the information understanding what is cancer. It was we were talking about stigma yesterday. And from our work, we can still see that in some areas of Europe especially, there is a kind of stigma. It's a cultural stigma. And when some people still believe that cancer is contagious, you know, it can really affect people in your working place and in your home, in your family, there is something wrong. We need to really reduce that kind of opinions and to teach people and inform them that cancer is an illness, is a diagnosis that can, well, mostly nowadays be treated somehow. Of course, you can live also very long with the cancer diagnosis, but many cancers nowadays can actually be treated. So understanding and information is, I mean, also within that, we can boost these preventive actions and also to see that, okay, you can be early detected also. Your cancer can be early detected and it will help you. I have been talking about this in many meetings and the past few years now, that we need trust. We need trust for healthcare. We need trust between each other to see that also we need to go to the screening when we're asked to. Please, if you're asked to go to screening, do that. Otherwise, your prediction will be fulfilled. Okay, if I don't go there, I will not have this diagnosis, and then it will be okay. No, it will not be okay. You need to go there because the earlier you are diagnosed, the better you can be cured or have a better treatment. So this is really something that we all need to talk about and inform people about this. But I will come back to the fact that it's about trust. If people don't trust healthcare in your country, in your region, or locally, of course you won't go there. That's the fact. So you need to have trust and to build trust between healthcare systems, healthcare professionals, and patients. Of course, we also need diagnostics and treatments that are innovative and to also create systems for that, for implementation. It's not good enough today in Europe that there can be so many inequalities by getting access to diagnosis and treatments. So I love these 4 goals for both the Cancer Mission and the Europe-Speaking Cancer Plan. And if you don't remember anything of what I have said today, please keep in mind these 4 goals, because it's really something that you can use in your work. Now I'm coming to that. Understanding, information, of course, knowledge, prevention and early detection, diagnosis or diagnostics and treatment, and quality of life. And quality of life is something that we are really working with in the Cancer Mission Board, to evaluate and to see what kind of quality of life do people experience. I mean, when they get their diagnosis, or during treatments, or after treatments. We know that rehab activities are very, well, it doesn't exist actually in some countries or areas of Europe. So we really need to make it visible that people may be cured, but it's still in your head. And the fear of getting the cancer back is really what you are facing maybe every day. So it's really also a mental thing that we need to take care of. So research and innovative actions, of course, at the EU level, and the synergies between the European level and national programs. You know, it's not like the EU is something above us. And when they take decisions in the European Commission or European Parliament, things are just falling at the countries. And that we can say, okay, EU decided this, so we need to do it. I am sorry to tell you that your own governments have been part of the decisions. So if they have not objected, it has been decided in consensus. And you have, your government, your country has actually been a part of the Europe-Speaking Cancer Plan, the Cancer Mission, and everything about it. So, if you have not been informed within your cancer organization more about how they are thinking about doing this in your country, then you should ask them. Because not every country yet has their own cancer strategies or cancer action plans. And that's really, really important. Otherwise, how do you know what is actually needed? How can access to cancer treatments be better and detected earlier and so on? So the synergies between the European Union and the national programs are vital. Otherwise, it will just be some kind of paper, a document on a shelf somewhere. But you need to be part of this. Ask questions to your politicians or other decision makers. So that's what linking EU, national and individual levels is all about, I think. When we, as European citizens, are asking questions and know what to ask for within these 4 goals in this area of cancer, then you can start, be at the same table and have good discussions, I think. The patient-centered approach is so important for us all. And that's also what these goals are all about. To have a patient-centered approach so that diagnostics and treatments and everything in the goals are actually about you and your needs and how you can be helped, or as a family member and so on. So, just ending up, EU is not something over there. It's actually here, among us, with us. And we are parts of this puzzle. We are the jigsaw puzzle, not only the blue sky and the blue sea that are so difficult to find the way in the puzzle, but we are these puzzle pieces that can fit together and also work together, exchange knowledge and information, also cross-border diagnosis. So we are here today about lung cancer, but I can see so many similarities also for working together between all kind of other cancer diagnoses and also other, of course, related diseases like cardiovascular, diabetes, kidney, or whatever. So I think we also can broaden our activities sometimes to see that, okay, the other ones in the other organizations, they are working also for the best healthcare, just as we do. And I will just finish with my favorite quote ever. Where should I go, asked Alice. That depends on where you want to end up, answered the Cheshire Cat. So, if we have a plan, if we have a strategy, we have something to follow, a roadmap to go on and from and with. So hope this at least will give a bit of where we end up as the puzzle pieces in the whole framework. Thank you so much.